I've had tics my whole life, I'd find them on me, but third grade was quite the experience. I got sent to the nurse's office because I felt something on the back of my head, and it was kind of weird, it was kind of freaking me out a little bit, so my teacher sent me to the nurse, and she pulled a tic out of my head. My senior year of high school, I was in a car accident, and I believe that's when everything just blew up. I mean, my fatigue was really bad after that over the summer of my senior year, and then my first semester into college, I was just so tired. It felt like, you had the flu or something. That's when I finally went to my doctor and I said, I don't feel good. First, they were suspecting MS, and they suspected that for a while, and then after so many tests they found out, all right, it's not this. We were trying to look into genetics, like what kind of things have been in my family. We couldn't really find anything, and then I finally, after everything, I got a diagnosis of fibromyalgia from every doctor I went to. I was on antibiotics for 2 months and wasn't feeling better, so they decided, all right, well, we're gonna try something else, and that's when they started testing me for everything. And then the following summer was when the pain started, like the joint pain, the muscle pain, and it started in my legs, and I was having trouble walking. I was falling because my knees would just give out on me, and then we just started on different medications. I was put on Lyrica, Cymbalta, Savella, I think was another one, and after those weren't working, then it was just, they didn't want to put me on heavy painkillers like the narcotics and everything, but it was just a matter of trying to control the pain after that. It wasn't really like they were focused on anything else. Continuing into the year, it started to go in my arms and up my back, and then I started feeling the neurological symptoms, like the brain fog, the memory loss, all of that, and it just kept, I went to see doctor, neurologists, rheumatologists. I wasn't getting any answers for it. It kind of felt like I was being pushed aside in the medical system, I always felt like there were certain tests that they wouldn't do on me. There were certain medications they didn't want to try on me, and I felt really unimportant in the system. I'd been denied by a couple hospitals. They didn't want to take my case because it wasn't a high enough priority, and to me, that kind of hurt, where it was like, well, I'm in a lot of pain, I'm dealing with these symptoms, and I don't feel important enough for you to look at me. But finding out about Invita, it was just kind of like that little bit of hope that I needed, that finally somebody cares about what's going on with me. They want to try their best to figure it out. They want to help me. And it was just one of the best moments. When I talked to my patient care coordinator, it was kind of overwhelming because they were saying how, yeah, we see a lot of Lyme patients and we have a lot of cases here and we've had really good results and we do this and this, and they were telling us all about everything that they do here, and at first it was kind of overwhelming because it was like, wow. Part of it was almost exciting to be able to finally find a place that was going to figure out what was going on and really focus in on the main symptoms. And they told us about everything that they do here and the process that you go through, and we'll come down for a consultation, and I was a little excited about it. We walk into this place and I was like, oh, it's really nice in here. It feels like comfortable in here, and everybody was super nice. Everyone at the front desk was all, hi, how are you? And how can we help you? And I was like, oh, okay. It's really friendly staff in here. I like this. The first week was kind of a little hard to get through because it was, I was adjusting to everything. It was a little overwhelming at first, but then the next couple weeks, I started to get into my own little system, and I started figuring out what works for me and what doesn't. And I was always talking to my patient care coordinator and my doctor, and I came in here with shooting, stabbing pain all over my body, and after the first couple weeks that was gone. Like, I don't feel it anymore, and I was really happy about that. My fatigue has gotten a lot better since I'm sleeping better, and there's so many things that I can do now. I can go back to some of my hobbies that I had to give up. I'd really love to go back to school and look for new jobs, and I'm just really excited to go back. I would definitely recommend Envita to somebody else.